Hello my geniuses, welcome to another Parasitology video today. It's your great science tutor Lorenzo, and today we'll be talking about Toxoplasmosis and Toxoplasmosis Gondii. So we'll talk about the Toxoplasmosis, which is the disease, and the causative organism, which is Toxoplasma Gondii. So if you have watched my last video on malaria, and I've also done some videos, you watch them and you come here and you continue with me on Toxoplasmosis. So if you are new to my channel, make sure to subscribe and turn on your post notification button, so at any time I drop any video, be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make the video for you when I see it. So let us jump right into the video. So now listen, we are talking about Toxoplasmosis. So what is the etiology and the definition of Toxoplasmosis? So Toxoplasmosis is a protozoa disease of man and animals produced by the organism Toxoplasma Gondii. Take it now. One is a protozoan infection, which means it's from protozoa. I remember the protozoa, the last one we did was malaria, which is also a protozoa infection, which you have plasmodium. So plasmodium is an ampicomplexia part of what protozoa. So Toxoplasmosis 2 is from Toxoplasma Gondii, which is also a protozoan disease. Are you getting me now? So it's an obligate intercellular protozoa parasite. Obligate means that it is compulsory, which means it stays and it needs to stay inside the intercellular space. You get it now? So one thing you have to know is a protozoan infection that affects man and animal from the organism Toxoplasma Gondii. And the Toxoplasma Gondii is an obligate intercellular protozoan parasite. Are you getting now? Now this toxoplasmosis, it varies in severity from a clinical imprint infection to a severe. So sometimes it can be asymptomatic, only causing little issues like fever and others, but sometimes it can rise up to a severe systemic disease that can cause encephalitis, meningitis, and death. So sometimes it can come with a small, very disease that is very minute, then it grows and invades so many tissues through the lymphatic system and go to do so many damage to the body. You get it now? So Toxoplasma Gondii is currently metropolitan in human population and can cause disease, which means it's present now. Because before it was usually in rodents that is located maybe in the forest or in the desert, but now it is now amongst us. And since it's amongst us, it highly causes infection. And when it causes some infection, sometimes it can be that bad that it can start causing death. You get it now? So that is why they say it's now in cosmopolitan, which means around humans now, and it can be seen in various population groups. Are you getting now? Which can cause infection. Now since the 1980s, since 1980, Toxoplasma Gondii have joined the number of other parasites that is recognized as a complicating factor for immunocompromised patients. So immunocompromised patients are patients that has a reduced immune system, especially those with HIV, those with some malignant issue whereby their immune system are compromised, whether there is failure of B or T cells that is absent, or patients on immunosuppressive drugs. So they have high resistance, they have high susceptibility to toxoplasmosis. You get it now? So that is what it has seen in people since 1980. Toxoplasma Gondii was first discovered before it was known to cause disease. So it was discovered by two people. Are you getting now? Which is Nicole and Mantius. So Nicole and Mantius in 1908 discovered it before it started causing diseases. Before it was a desert rodent. I get a Technodactylus Gondii. So Technodactylus Gondii, first of all, in a colony maintained at the Pastoral Institute of Tanos. That's what it was. So if they ask you, is Technodactylus Gondii? One, it's a desert rodent. I get him now. Now it was a house in a colony in Tunic, in the Pastoral Institute of Tanos. That is where it was before. And since then, the parasite can be found in carnivores, insectivoid. You can see it as a rodent, in pigs, in herbivores, in primates, in other mammals and bird. One thing you have to know that Toxoplasma Gondii causes toxoplasmosis, which is a protozoan infection that is highly bad. But might start up as a simple infection that is not bad, but later progress. It was found in 1908, and in 1980s, it joined, and it was seen more in affecting immunocompromised patients. But now it can now be seen among people now, causing a highly bad infection. Based on distribution, Toxoplasma Gondii can be found in almost every country of the world, in a wide range of animals and in birds. It's therefore a cosmopolitan parasite because it's not everywhere. But before, remember, it was in as a dozen rodent in 1908, but now it is now around us based on distribution. Okay, now so it's affecting both birds, primates, herbivores, insectivores, so everybody. So it's not around everybody. It was discovered in 1908 as a desert rodent. I get it now by Nicole and Manus in 1908 at the Pasteur Institute of Tunis. Okay, now so what is the important to human now? Human infection may occur through ingesting the oocyte. So the only way you can be infected by toxoplasmosis is by taking the oocyte, and the oocyte is usually the place where the host it usually stay more is in cats. So it's anyhow that you ingest the cat, or mistakenly the feces of the cat that contains the parasite, if you ingest it, it could damage the body. Usually it's in non-cooked meat, because sometimes when you eat you might not know what you are eating. So maybe when you ingest any food or any tissue that has the cyst in it, when you ingest it, you can take it inside your body. It can also be transmitted from mother to child through transplacental route. So if a mother is having Toxoplasma gondii, are you getting now, or has been treated for toxoplasmosis previously, and the patient is pregnant, what happens? It can be transferred from the mother to child to the placenta. You get it now. So one, it could be that you can take it to consuming uncooked meat, or having coming close to a cat feces that is ingested, that is infected. Now it may cause severe disease in immunocompromised patient. I told you, with patient with HIV, patient with autoimmune disease, patient that has an undiagnosed condition that is very bad and susceptible to other infection, you might have it there. Or patient that is on immunosuppressive drugs, because now they don't have immune system, and since they don't have immune system, we can put them chance of what being affected fast. It can affect multiple organs because it passes through the lymphatic system. It could affect multiple organs like the brain, the eyes, the lungs, the liver, and the muscle. A major opportunistic infection is in patients with HIV. I told you, in patients with HIV, they are much more accessible because their T cells are down. And remember, T cells are usually prime in helping us destroy antigens to the antigen presenting cells, which are the macrophages, the neutrophils, all of them. So in AIDS people, they don't have immune system, and people that have maybe B and T lymphocyte deficiency. So B and T lymphocyte deficiency, which means your body cannot produce antibodies, or produce or T helper, T killer, or suppressor T cells, which could be bad. Now take a look at the trophozoite now. The trophozoite of a Toxoplasma gondii. So you can see its nucleus. See the nucleus in center, and the nucleus has a nuclear pores. So you can see the endoplasmic reticulum where translation of their antigenic protein occurs. So you can see the Golgi apparatus where the proteins are packaged. You can see the nucleolus, you can see the vacuoles. Now you can see the conoid too. There's a conoid there. There is a fibers of the internal membrane. There is a taxomer there. So all these things are the outer structure of a trophozoite, because the trophozoite, when the sporozoite enter into the body, we'll call it the sporozoid of the brachiozoid. So when the brachiozoid is ingested, enter into the body, it moves to the intestine and form a trophozoid or a tachyzoid. So it's very, very important. When you go there, you see. So when you have a trophozoid, you get a trophozoid from a sporozoid, just like the way I taught you malaria. You get it now, it's the same thing. So the next thing we'll be reviewing is the life cycle of Toxoplasma gondii. So keep with me, Toxoplasma gondii. Now Toxoplasma gondii has a complex life cycle. One thing you have to know, it has a complex life cycle. Remember, discovered in 1908 by two French people. I get him now at the Pasteur Institute of Tunis. I get it's a rodent. It's a rodent, a desert rodent, but now it's more cosmopolitan because it's around us. Okay, now, but it has a good life cycle. Now the life cycle is sexual and asexual. The sexual is usually in cats, which is the definite host. So for exam, if they ask you what is the definite host of Toxoplasma gondii, the definite host in cats. So in cat feces, or the tissues of a cat, if when ingested uncooked, what happens? You can transport it to humans or animals that are warm-blooded, because in warm-blooded animal, that is its immediate host. Its immediate host is where it can thrive. But naturally in cat, it doesn't affect them like that. That's where they breed, in their intestine. But when it gets into human, it now start causing some systemic side effect and infection. So always remember, definite host cat reproduce by sexual reproduction. Are you getting, especially in their intestine? Remember, when it's inside the cat, it attaches to their wall of their intestine, reproducing by what, sexual reproduction. So now in when it now enter into human, that is by what, it now reproduced by asexual reproduction there, and also in the intestine of human. But one thing is that it not produce what, systemic side effect. So we are taking it from either by the tissue cyst. So when you are taking it from the cat, it's either you are ingesting the tissue where that contains the cyst, maybe you are eating the meat of a cat or the meat of any animal that it is infected. So because in the tissues now it becomes a cyst there, and when it becomes a tissue cyst, and the tissue cyst can be sporozoid or brachyzoid. So when it is a sporozoid or a brachyzoid, it's there in the tissue cyst. If you eat it, you tend to bring in the brachyzoid or the tophozoid, or you tend to bring in the sporozoid or the brachyzoid into your body. Or if you are ingesting the oocyte is present in the cat feces, why the brachyzoid is present in the tissue of the what, animal. So we have the definite host cast, intermediate host is what, human or animal, while the infective stage is either in oocyte in the feces or in the tissue cyst present in one meat. So let us run through the intestinal development. How does it do in the intestine? Because we have there's sexual reproduction in the intestine of a cat and asexual reproduction in the tissue of a warm-blooded animal, which is a man or an animal. So first of all, how does it happen in the intestine of a cat? First of all, the cat ingests the oocyte. Are you getting now? Either the cat is ingesting the oocyte or the cyst, the tissue cyst. Again, so it's either the cat, maybe from another tissue, maybe the cat is feeding on a dead tissue it saw somewhere or so, or a feces mistakenly, and it's exposed to the tissue cyst or the oocyte. So when the cat is exposed, what happens? It could be from food, it could be from water, it could be from other prey that are dead, or rats, because rats are always good in eating rodent. So when they see rodent, they eat. But mistakenly, if they go to eat any rat that has Toxoplasma gondii, which is the Cyanodactylus gondii. Now when they take a rodent, especially the Technodactylus gondii, which has Toxoplasma gondii, because the Technodactylus gondii are desert rodent that has Toxoplasma gondii. So if this cat eats anything from it, maybe the food or water or any prey that are infected, so you see it's either they are taking the oocyst from where, from the feces, or they are taking the tissue from the meat of a rat. So anyone they do, they ingest it, and when they ingest it, do you know where it goes to? It goes to the small intestine. So when it goes to the small intestine, what happens? It will be going in. So what are they taking in? They are taking in the sporozoid or the brachyzoid. Are you getting now? They are taking in the sporozoid or the brachyzoid. So that thing the cat ate, is the sporozoid or the brachyzoid, and when it enters into the body, it goes to the intestine. But you see, in malaria, what did I tell you? When the female Anopheles mosquito bites the human, what happens? It releases what we call a sporozoid from the salivary gland, and that sporozoid goes to the liver and becomes an hepatic schizocyte. Are you getting now? But here now, it's not going to the liver, it goes to the intestine, and when it goes to the intestine, it forms a what we call a sporozoid. When it goes to the intestine, they become sporozoid or the brachyzoid. That is the brachyzoid and the tophozoid that is entering into the intestine. When they enter into the intestine, do you know what they do? They multiply. Are you getting it now? They multiply inside the intestine and becomes a tophozoid. You get it now? They becomes a what? A tophozoid. So they are entering as a brachyzoid or sporozoid, and now they are now multiplying to form in the intestine to form a tophozoid. Are you getting now? So now when they form a tophozoid, what happens? So it's either they are forming a tophozoid, or you can call them the tachyzoid. So tachyzoid is an actively proliferating tophozoid. You get it now? So sporozoid or brachyzoid to tophozoid. Are you getting that? So the tophozoid, when it is actively replicating, we call it a tachyzoid. So now in the intestine, what happens now? The tophozoid multiply by endodigeny reproduction. So when it starts reproducing by bonding, what happens? It undergoes sexual reproduction or sexual development to form what? A gametocyte. So we have sporozoid or brachyzoid, which multiply in the intestine to tophozoid. Then the tophozoid now becomes to multiply, forming what we call a tachyzoid. So the tachyzoid is the active form of this tophozoid, which multiplies to form a gametocyte now. So the gametocyte here, fertilization occur because you have a male gametocyte and you have a female gametocyte. So the male and female gametocyte does what? Fertilize to become a zygote. I get him, and that zygote now fuse together and become thick to form an oocyte again. So it's the cycle. So they are ingesting it as oocyte or tissue cyst, and now when the male and female gametocyte undergo fertilization, they form what we call an oocyst. And you know what the oocysts do? It take about 1 to 5 days. The oocyst enter into the environment and it could be released. So the oocyst will be, since it's inside the intestine, the oocyst will be coming out as the feces. Are you getting it? So the cat feces, the oocyst will come down and stay inside the cat feces, waiting for another way to enter into human or any other. It could be animal that eats anything they see. Are you getting now? Don't forget. So by ingesting it as oocyst or tissue cyst. Tissue cyst is when it enters into the muscle and it stays of the rat or any parts. So when it enters into the rat or any warm-blooded animal, are you getting me now? When it enters there, do you know what happens? It is not being released by the feces of a cat. Remember, it doesn't affect the cat. Cat is just the host that carries it. So when the cat excrete it out, it stays there and another animal comes and take it. It could be a rat, it could be an herbivorous, it can be a carnivorous, it can be anybody, it can be an insectivoid are insects that can come. Maybe they feed on animals. So when they come, they feed on animals. They are insect like that. So they take it and go and bite another animal. So when the insect go and bite another animal, it transmits it inside. So now what happens outside the intestine? So when another animal takes it, now we call it the extraintestinal development. So we have the intestinal development in cats and the extraintestinal development. So now let us say another animal now take it in. What happens if you now ingest it? Maybe you are ingesting the oocyte from your environment. You take it, maybe mistakenly you take it from your environment and it enters your body as the oocyte, or you are taking it as the tissue cyst when it enters into the muscle. So when you take it in, what happens? What have you ingested? Remember, you have always ingested the sporozoid and the brachiozoid. The sporozoid or the brachiozoid are from the oocyte that was ingested by any animals. So when you ingest the sporozoid or the brachiozoid, what happens? It will enter into the intestine and multiply to trophozoid. Remember, the trophozoid was multiplied by what we call endodigeny, which will form what we call a tachyzoid. So we get it. Sporozoid or brachiozoid enters into the intestine and form what we call a trophozoid or a tachyzoid. So sporozoid or brachiozoid forms what we call a trophozoid or a tachyzoid. Are you getting me now? Now what does the tachyzoid do? The tachyzoid now passes through the blood or the lymphatic system. I get him now to various organs, just like the one it does in the cat. But in the cat here, what happens after you form a trophozoid and the multiplying form, which is a tachyzoid? Do you know what happens? It now forms what we call a gametocyte, which combines together to form an oocyst. But in this one, no, it doesn't happen like that. It infects other tissue because the tachyzoid now will pass through the lymphatic system and the blood vessel, going to various parts to infect them. So when it passes through, it goes to the lungs, liver, brain, muscle and eyes. You know what it do? It now cause some chronic infection. Again, so how will it cause some chronic infection? Because if it gets there, the tachyzoid now becomes a what? A brachiozoid. Are you getting now? Because remember, I am coming as a sporozoid or a brachiozoid. Now I'm coming as a sporozoid or brachiozoid. I enter into the intestine, forms a trophozoid or a tachyzoid. So when I form a sporozoid, a trophozoid or a tachyzoid, I move through the blood vessels and the lymphatic system to tissues. Now what is the tissues? The brain, the lungs, the muscles. So when I split myself to a various part, you know what I'll form? From a tachyzoid, I will now form what they call a brachiozoid. Now is brachiozoid or sporozoid? They are together. So the tachyzoid will now become a sporozoid or a brachiozoid, which will infect what we call tissues. So when you infect tissues, do you know what will happen? Now the tissues will now house it for a long time, so it can now start causing some chronic infection. It causes some chronic infection like that. But in cats, when you form a trophozoid, the trophozoid or a tachyzoid will now form what we call a gametocyte. But for cats, there's usually trophozoid there, but for human it's usually it's more replicating, or it's much more multiplying by endodigeny, so it will form a tachyzoid. So there's more of trophozoid for cat and there's more of tachyzoid for man. Are you getting now? So look at it. Tachyzoid are rapidly dividing. Are you getting now? They are rapidly dividing, converting to bradyzoid. So bradyzoid are slowly dividing, and when bradyzoid enters into the tissue, they become dominant. Are you getting now? Forming what they call a tissue cyst. Are you getting now? So that tissue cyst for this thing for cat is what another animal picks up. While in human, if you form a tissue cyst, it can start infecting that tissue, causing for complex what systemic what effect. So always remember, what are the forms of disease? You have a tachyzoid, you have a bradyzoid, you have the oocyte. Are you getting now? From sporozoid or bradyzoid, you form a tachyzoid. From tachyzoid, you form a bradyzoid again. And from bradyzoid, you either forms an oocyte or you form a tissue cyst. You get it now? So a tachyzoid is rapidly proliferating and it gives what we call a crescent or banana shaped. It forms what we call an acute infection because it's just entering into the blood, passing through the lymphatics, so it causes acute what infection. It is present in many tissues and body fluid. But the bradyzoid, what happens? The bradyzoid is slowly growing. It's slowly growing very well. It's slowly growing, and what happens? The bradyzoid is formed inside the tissue cyst. Remember, tachyzoid enters into the tissues. Are you getting now? When it enters into the tissues, what happens? It hibernates there, forming a tissue cyst. Are you getting now? Tachyzoid form a bradyzoid. Bradyzoid enters into the tissues, forming a tissue cyst. So it is now the bradyzoid that forms a chronic infection because it's slow growing, but a tachyzoid forms acute infection because anything that makes it from the intestine passes through the lymphatic system into the blood. When it enters into the blood, immunity will occur, inflammation will occur because white blood cell will sense them inside the blood and start what inflammation reaction. Okay, now but in bradyzoid they are already in tissues, and when they are in tissues they can hibernate for a long time. Are you getting me? That's why they form chronic infection. But oocytes are present in cat feces. Are you getting me? Don't forget, oocytes are present in cat feces. Why? Tissue cysts are present in tissues, and tissue cysts can be taken into human by uncooked meat. You get that? Uncooked meat. So now, but in oocytes now, they are unsporulated. Unsporulated because they don't release spores. They are just there until you ingest them. The only time they can produce infection is when they become sporulated. I get them now, when they become sporulated. So the next one, what is the mode of transmission in human? So you can transmit it through ingestion of the oocyte. Remember, the oocyte can be seen in cat feces. So when cat feces is in a plant, or maybe you are planting any food product in that plant and there's cat feces there, what happens? It can diffuse through the soil. When it diffuses through the soil, it will contaminate the soil, and when you harvest the soil to eat, you can transmit Toxoplasma gondii into your body. But when you are taking, if it's through the feces, it is called what? This oocyte. It's called the oocyte. But when you are taking it through meat or the tissues, you are calling it a tissue cyst. So there's difference between oocyst and a tissue cyst. You get it now? So it's either you are ingesting the oocyst through contamination of the soil by the cat feces, or you are taking it by a tissue cyst by eating an uncooked raw meat, which is mistakenly, it could be from a cat or it could be a rodent, it could be any animal that already has the bradyzoid inside this tissue. It could be from mother to child through the placental route. It can be from mother to child through the transplacental route. Yeah, that. So it can also be from organ transplant, whereby transplanting one organ, maybe by screening, the organ might not be detected to have what they call the bradyzoid or the tissue cyst. Even when they are screened, they screen the tissues very well before transplanting them. But when it gets into the host, it might now cause a high, very important systemic effect. But it's usually rare because most times transplanting committee tend to screen the tissues before transplanting. It could be by laboratory accident too, maybe doing experiments on this toxoplasmosis. It could be transmitted like that, but it's also rare. So what are the factors influencing the degree of what pathology? One, age of the host. Are you getting that? Older patients are more susceptible to what disease. Why? Because their immunity are reduced. Their hematopoietic stem cells are weakly growing. So remember, their bones are no more producing red blood cells. So now their liver and their spleen are the one producing blood cells for them. So they are weak. One, they have low immunity and they have low resistance to diseases. Are you getting now? So they are always more susceptible. Violence of the strain. Now there are different strain of Toxogondis. There are different strain. It depends, but there are much more wicked ones and there are much more mild ones. So it depends on the one. So it's age of the host. It could be the violence of the strain of the Toxoplasma gondii. Now it could be in the natural susceptibility of the host to the species. Are you getting now? Different species shows varying susceptibility, like I said. Now your host, the one that if you are a human, even though you are not old and your immune system drops, or you are much more, you have a gene that reduces when the pathogens enter into your body. It could depends. It could be the natural susceptibility of the individual host. It could be genetic. It could be what immunological factors that influence it. Also the degree of acquired immunity. I get it now, because naturally after giving birth, a small baby or a child that has just been given birth just have with that is not immunized, so they have what they call innate immunity, which is covered by the immunity of the mother. But after immunization and you have given vaccines, what happens? The child now has what they call acquired immunity. Are you getting now? So which makes the child to be less and to be highly resistant to Toxoplasma gondii. So remember, age of the host, violence of the strain. It could be natural susceptibility of host species. It could be the natural susceptibility of individual host. It could be degree of acquired immunity. So we have classification of Toxoplasmosis. Yeah, we have different. Again, you have acute toxoplasmosis, you have subacute toxoplasmosis, you have chronic toxoplasmosis, and you have what congenital toxoplasmosis. Again, now in acute toxoplasmosis, because I'll still talk about the 100%. In acute toxoplasmosis, what happens? The parasitemia, which means the parasitic action, only occurs for days and weeks, so it's very acute. When you take drugs, it goes, and sometimes your body's immune system fights them and they go. In subacute toxoplasmosis, there's prolonged, because the pachyzoid continues to infiltrate into the tissues, converting to bradyzoid, so it is much more prolonged, more than weeks. I get him now. In chronic, which means what happens, the infection persists for about months to years, because the pachyzoid it converts to bradyzoid, which is in the tissues and can compromise the blood flow and also compromise so many chemical reactions that occurs in the tissue. So chronic toxoplasmosis is very much, because it affects the individual for months and years. Congenital toxoplasmosis is very also is from mother to child. I get him now, but it's sometimes a systematic infection in newborn, but it's usually converted from mother to child to placenta, and when it goes from mother to child, it stays in the child and maybe cause somewhat congenital defect in the child. Okay, now what are the target organ? The brain. The brain is usually the target organ. If it goes through the blood vessel or through the lymphatics to the brain, what will it cause? It will cause meningitis, encephalitis, it will cause mental retardation and seizures. If it enters into the brain or into the CNS cavity, what happens? It can cause meningitis. Always remember, I've said it. Meningitis infecting the meninges. It can cause encephalitis, compromising the brain tissue. It could cause mental retardation, disrupting some movement of the brain tissue. It could cause seizures when there's increase in abnormal brain activity. If it enters into the eyes, what is it causing? Vision loss, normal, because it will infect the sclera of the eyes or the cornea of the eyes, causing what we call choroid or retinitis. So there could be choroid retinitis between the choroid and the retina. You'll be having vision loss because there will be damage of the optic nerve, or causing optic neuritis. When it enters into the lungs, it destroys the lungs parenchyma, causing what we call pneumonia, or what we call pulmonary lesions in the lungs, increasing mucus, increasing liquid, increasing the surface tension, preventing air from getting into the blood to cause what? Hyperfusion. If it enters into the liver, it causes hepatitis and hepatomegaly. If it enters into the muscle, it causes myositis. Enter into the lymph node, it causes lymphadenitis. So it depends on where it enters. I get him now. So remember, it is always an opportunistic pathogen, because it enters immunocompromised individuals, especially those that are on chemotherapy and blast radiation. I get him now. It affects them more. Those that are HIV patients, those that are some autoimmune diseases that are very prone to those infections. So like I said, also let us push through. Remember, for acute toxoplasmosis is the first site of infection. I get him now. So when it leaves from the cat into the human, it enters into the host, it spread to the tissues, what happens? At this particular point, it stays for days and weeks, remember? Are you getting now? Remember, from bradyzoid, it enters by bradyzoid or trophozoid to tachyzoid. Tachyzoid migrates to the various tissues. And remember, when it enters the blood, what happens? It causes white blood cells, which is pro-inflammatory cytokines are released, which changes the hypothalamic set point, increasing the body's temperature, causing fever. Also, what happens, as far as there's fever, there will be increase in CNS permeability of the meninges. So the blood supply to the meninges, there will be permeability of the vessels that are supplying the meninges, causing what? Cerebral edema, which you can see as headache, can cause anemia. Why? Because it will infect red blood cell, breaking them down by hemolysis, causing hemolytic anemia. It can cause muscle pain, because remember, if the tissues remember, if the brachiozoid are present in the tissues, what happens? Remember, when acetylcholine binds to the nicotinic receptor, they open out the ion gated channel for sodium to enter. So when it is present in the tissues, what happens? It prevents binding of acetylcholine to the nicotinic receptor. Are you getting now? Causing what? Weakness, muscle pain. So also it can infect the lungs too, causing different lung complications. Also, remember, it will pass through the lymph nodes, and if you enter the lymph nodes, anytime there's an infection, the lymph node will swell, causing what they call painful swollen lymph nodes in the inguinal, cervical, and supraclavicular water region. In subacute is when the proliferation and the spread of infection is between some more than weeks to months. I get it. It's slow going and it is continuous. It's destroying tissues, and they're passing to organs in the brain. I've told you, in the brain is causing extensive CNS defect. In the lungs is causing what? Pneumonitis. In the heart is causing myocarditis or endocarditis or epicarditis or pericarditis. Is just infecting the tissues of the heart. In the liver, it is causing what we call hepatitis and what? Hepatomegaly. In the eyes, is causing retinitis, optic neuritis, and some lesions. Are you getting now? Now, in chronic toxoplasmosis is when it's between months to years, and when it's between months to years is when the brachiozoid is slow growing. So this can cause tissue damage over a long period of time. Are you getting now? So the cyst can remain inside the tissue for a long time. It's not producing symptoms, but the damage is happening small. Are you getting now? Now, one thing you have to know now, it can enlarge, forming a tissue cyst inside there. So when it forms a tissue cyst, if the cyst ruptures in the retina, it can cause retinal inflammation, destroying the retina, causing blindness. If it enters into the heart, it can cause myocarditis, preventing what? The myocardium to receive what? Calcium, to cause contraction. It could cause pneumonia. It could cause chronic encephalitis with paralysis. Congenital toxoplasmosis, what happens? It could pass between mother to child to placenta. If it passes between mother to child, maybe it stays inside the tissue of the child, causing tissue cyst or brachiozoid. Sometimes it can affect the child to the point that abortion will occur. If it goes to the neural tube, affecting the child's brain, there could be hydrocephalus or microcephaly, because the child's brain will not form very well. And the child brain doesn't form very well, or there's no closure of the neural tube, the anterior neural pulse, causing microcephaly. It could be an increase in the cerebrospinal fluid, causing hydrocephalus. I get him now. Sometimes it can go into the brain and calcifying tissues in the brain. I get him now. So calcium will infiltrate into the cerebral tissues, causing cerebral calcification. It can cause choroid retinitis, affecting the choroid of the eyes in the medial tunic, and also the retinal too. It can cause mental retardation and psychomotor disturbance. And remember, this can compromise the brain tissues, increasing neuronal transmission, causing what? Epileptic seizures. So when a patient is having epileptic seizure, which means there's infiltration to the brain, and you could diagnose by using a spinal tap, because maybe the Toxoplasma gondii will have not formed an abscess. It's only when it has formed an abscess that you can use an MRI to check. But if it infiltrates, you could use a CSF spinal tap to check. So you could use, in calcification now, you use an MRI. In neural tube defect or anything, you could use, but we'll do that under diagnosis. So the next thing is the laboratory diagnosis. How can you diagnose it in the laboratory? Because this one is just a simple diagnosis without use of large large equipment. So toxoplasmosis gondii can be isolated, so you can bring it from any of this tissue. Are you getting me now? If it's the brain, you take it from the CSF fluid through spinal tap. You can take it through blood tests. You can take it through sputum or saliva. Are you getting me now? You can take it from the lymph node by doing a lymph node biopsy. You can take it from the muscle. You can take it from the liver. You can take it from the skin, and you can take it from sputum too. You get it now? So these are where you can take the sample for testing. So when you take the sample for testing, you put it in the mice. So mice are more suitable medium for cultivating the parasite. So when you take it from the CSF, what happens? But sometimes, because when you do a spinal tap, you check for presence of protein, or you can check for presence of the glucose level there. You can check for presence of white blood cell count. But all these things you check for, it might show you that there's presence of an infection. But it's when you now put it inside the mouse, then it will not show you what type of bacteria you are dealing with. Are you getting now? So now, but if you put it inside the mice, you now check it whether it's showing signs of toxoplasmosis. You can do a serologic diagnosis. In serologic diagnosis, are you getting now? The most suitable serologic diagnosis is the Sabinderman's or dye test. The Sabindermide dye test is you call it SFD test. In the SFD test, what happens is the most suitable and important way towards test for Toxoplasma or Gondii in the laboratory. But you can also use other tests, other serology tests. Like you can use the complement fixation test, you can use DATs, you can use HAT, you can use FAT. These are mnemonic: CFT, DAT, HAT, and FAT. But the Sabinderman or dye test is the most suitable test, because now you take the sample of blood you want to take and put it in a petri dish, and when you put it in a petri dish on a slide, you know what you do? You now add what we call a methylene blue stain. We call it the Sabinderman dye test. So when you put it in a petri dish, you now put your serum there. After putting it in a petri dish, you put your serum. When you put your serum, you put your methylene blue. You now put it inside the microscope. What do you see? The parasite will be stained with blue and appear to be intracytoplasmic. You get it now? So this Sabinderman test is very, very important, because it detects the antibody that prevent uptake of the dye. Are you getting now? By a viable tachyzoid. You get it now? So very, very important. So when you are putting the sample you have taken, you put a serum. When you put a serum, the serum will contain the antibody. Then what do you put? You put a dye. Then the tachyzoid or the bradyzoid will take up the stain, and when they take up the stain, you catch it. So the Sabinderman test, don't forget the Sabinderman test is very, very important. But when you are doing for malaria, remember you have a thick and a thin smear. You also do a rapid diagnostic test also for malaria. You can do a PCR. You can do various ways to get it, but in this one you are using a Sabinderman test. I get it. But you can also do a complement fixation test. You can detect it by testing the body to see the presence of complement fixing antibodies. For complement fixing antibodies, immediately there is Toxoplasma gondii, and the B lymphocytes produce antibodies. They will also produce complement fixation antibodies or complement proteins. So the complement proteins, you can test it with a complement fixation test. The next one is that is direct agglutination test. I get it now. Direct agglutination test. Now you test by antibodies attachments to the Toxoplasma gondii antigens, because naturally when antibodies see the Toxoplasma gondii antigen, what happens? They go there and render them soluble, so that they will not be able to attack and sometimes phagocytose them. You get it now? So in complement fixation test, remember, if there's Toxoplasma gondii inside the body, complement protein will be released alongside antibodies. So now in the direct agglutinin test, you want to see how antibodies will show an agglutinin soluble with Toxoplasma gondii. In the hemagglutination test, which is HAT, remember CFT, that HAT. In the hemagglutination test, what happened? The antibody agglutins they sensitize sheep red blood cells. The antibody agglutinin sensitized sheep red blood cell. That is for the HAT. And the FAT is fluorescent antibody test. In the fluorescent antibodies test, what happens? You will use a fluorescent label antibody to bind with Toxoplasma gondii antigen. So you now have an antibody with a color. I get it now. The antibody will be stained with a color, and when it enters, it will go every point where the Toxoplasma gondii antigen is. It will go there, bind to them, and highlight that place, so that it will be easy to go there and mark it. It's just showing the same thing as a DNA probe. But this one, you are using it as a probe in order to catch what antigen. But yes, you can call it a DNA probe. You get it now? But the most important way is the subundermal what test. Subundermal what test. But you now have a CFT, you have a DAT, you have a heart, and you have a fat. What are the additional diagnoses? In the additional diagnosis, you can use a PCR. The PCR is used to get the what DNA of the what Toxoplasma gondii. Again, you could do a PCR. You can do a bioassay on a mouse. I guess it's highly sensitive, but not it's rarely in use. You can do a bioassay on a mouse. So if it enters into the CNS, you can use an MRI or a CT, or you can use an ultrasound to check for congenital CNS toxoplasmosis. I get him now. Now you can do a tissue biopsy. Take that tissue that contains a cyst. If you take that tissue that contains a cyst, what happens? You do a biopsy of it to check the sample. I get him now inside the laboratory. So for chemotherapy, how can you offer your treatment? Always you can use a speramycin. Speramycin is safe in pregnancy, but I'll still have a video where we also do antibiotics. So in antibiotics, you also use seed drugs that are used to treat toxoplasmosis. But speramycin is safe in pregnancy and could be used. So trimethoprim and sulfamethoxazole, what is it used? They are used also. They are folic acid analogs. The folic acid analogs, the antibiotics that are folic acid analogs. Well, what do? They inhibit the DNA synthesis of the Toxoplasma gondii. You get that? So you can use SMX and TMP. You can use atovaquinone also, which is an anti-malaria drug. You can also use it. You can use clindamycin together. So clindamycin can be paired with pymetal. So you can use clindamycin together with pyrimethamine. So clindamycin, pyrimethamine are good agents to combine to treat your Toxoplasma gondii. So remember cats. So if you remember cats, since Toxoplasmosis is having the first host to be cats, so remember cats are used to treat Toxoplasmosis. So what is cat? You have clindamycin, which you pair with pyrimethamine. You have atovaquinone. You have trimethoprim, which you will pair with XMX, and you have spiramycin. So prophylaxis and prevention. So how can you prevent it through prophylaxis? For example, make sure you get him now. You offer hygiene by handling soil. So after you handle your soil, or maybe you have planted or you have caught raw meat, what you happen? You have to wash your hands very. If you have a cat, you make sure that the cat, you clean it, and make sure when the cat goes or excretes, you clean that place very well. You put your gardens very well. Wash your hand always, so that because it's that same hand you used to eat, so you don't want it to be infected. Cook your meat very well before you eat it, because you don't know the meat you are eating, and because if you eat a raw and uncooked meat, you can take in the tissue cyst into your body. Avoid contact with cat feces, because when you have a cat and you want to take out the cat feces, and make sure you are wearing a glove. I get him now. So you clean it very well, because immediately it enters your body, it hides and start causing infection for you. Wash your food very well, because you don't know what it has been exposed to, or which animal has tasted it or transmitted anything there, or which plant it is going from. So you have to wash your fruit and your vegetable. Pregnant women should avoid risk factors and get screened very well. So pregnant women should be either by using a subundermal test or using a complement fixation test, or that heart or fat. And you have to vaccinate the child very well, because remember, it's much more prominent in immunocompromised patients, especially patients or baby that have not been vaccinated, or they are still unimmunized, so it can affect them very well. So I hope it all makes sense and you have understood everything I've talked about in Toxoplasmosis and Toxoplasma gondii. Remember, Toxoplasmosis is a highly protozoa diseases that affect humans and animals. I get him now, because naturally its main host is cats, but when you take any food, it could be exposed to excretors of a cat, or you eat the meat of an infected, you take in the tissue cyst, or you take in the spores or it into the body. What happens? It stays inside the tissues, becomes a obligate intercellular protozoan. I get him now. So when it enters into the body, what happens? It becomes a tachyzoid. Tachyzoid passes to the blood and lymphatic system and becomes a bradyzoid. Yeah, now so it can affect tissues in the brain, damaging the brain, causing retinitis in the eyes or coronal retinitis, causing encephalitis, causing pneumonitis, causing hepatitis, causing myositis, causing lymphadenitis, causing various stuff in the body. It can be transmitted from anybody, placenta, mother to child, and mostly in immunocompromised patients. So if you are joining me the first time, make sure you subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make that video for you. So I'll be seeing my next video on leishmaniasis. Bye bye.